Hello, my name's Lacey Lamb. How are you today?
I'm doing all right.
I'm just going to ask you a bunch of questions on your visit here today. This is your first time in our office?
Mm-hmm.
Okay. We just want to do a thorough exam, make sure we get all of your history, any problems you've ever had health-wise, and then I'm just going to do a head-to-toe assessment, so pretty easy stuff, vital signs, check for some reflexes, probably stuff that you've all had done before, okay? First, I need to ask you some questions. Sometimes this can seem to take a long time, but it's a thorough, investigation of what you've been through in your life, any things that you have going on.
Okay.
So first thing I want to ask you today is, do you have any pain?
No.
No pain at all?
No.
Okay, so a 0.
0.
Okay. Have you had any issues lately that you would come here, or is this just for a kind of a general physical?
Yeah, just a routine general
Okay.
checkup.
All right, good deal. Have you had any surgeries in your past?
Mm-hmm.
Okay, can you tell me what they are?
Yes, I was born premature, so I had a
Okay.
colostomy, and then I got that reversed
Okay.
at about a year. And then I recently just had my gallbladder taken out.
Okay.
Mm-hmm.
Any complications with the surgeries?
No, just anesthesia. Doesn't.
Okay.
that's
What happens when you come out
I
of that?
just get sick,
Okay.
nauseous, and throw up.
Okay. Do you have any allergies?
Yes, C-chlor.
And what does that do to you?
Gives me a rash.
Okay. So how premature were you?
I was born at 26 weeks, and I was 1 pound 6 ounces.
Oh, wow.
Yeah.
Okay. Alrighty. When was the last time that you had to seek medical attention or been to a doctor for anything?
It was just for my gallbladder.
Okay.
Mhm.
All right. Never had any vital signs out of whack or anything like that. Okay. I want to go over your family history. So it's just going to be immediate family. Your mom and dad, your siblings, or their parents.
Okay.
Even if it's anything that really sticks out in your mind as far as one of your parents' siblings. Let's see here. Any instances of bleeding disorder?
Mm-mm.
Cancer?
My dad's mother had a brain aneurysm, so.
Okay. All right. Diabetes?
My grandpa.
Let's see. Hypertension?
Mm-hmm. My mom, my dad, and my grandpa.
Okay. Alrighty. Any thyroid or glandular issues that you can think of in the immediate family?
Mm-mm.
Okay. Kidney or liver problems? Okay. Alright. Good deal. All right, well, that sounds pretty good. Have you ever had any like seasonal allergies or postnasal drip?
Yeah.
Okay, and you got that going on right now, probably. Okay.
I do.
All right. Do you take anything over the counter for the allergies? Any Zyrtec or?
Mhm.
Okay. Any nasal sprays or anything like that? Okay, good. Do you take the Zyrtec something year-round or just as you need it?
Just as I need.
Okay.
Mhm.
While we're speaking of daily meds, do you take like a multivitamin, a probiotic, any over-the-counters that you can think of?
I take a 1 a day women's vitamin.
Okay, good deal. All right. And just since we're doing kind of overall health, do you take any form of birth control right
Mhm.
now? Okay.
I do. Just an oral birth control.
Okay.
Mm-hmm.
You don't have any troubles taking any oral meds, any trouble swallowing, nothing like that? Okay.
No.
Alrighty. Let's see here. I think we've about covered most of the questions I need to ask you. You don't have, other than when you were having issues with your gallbladder, you don't have any abdominal discomfort after eating or any changes in bowel or anything like that that you can think of? Okay. Ever get any dizziness? Okay. Okay. And have you had any weight fluctuation in the last 6 months to a year? Any weight gain or weight loss that's unexplainable? Okay. Do you ever have issues retaining fluid? Like, do you ever have any swelling in your ankles or your hands?
No.
Okay. Alrighty. Well, I am going to wash my hands, and then we're going to do, like I said, it's a head-to-toe assessment. It might seem a little bit excessive because I have to start from the scalp and go all the way down. You're not uncomfortable right now or anything, and you're still not having any pain?
Nope.
Okay, I'm going to wash my hands. Okay, here are my paper towels. Okay. Well, I don't need to get any tools yet because I'm just going to start by touching your hair, going through your scalp, okay? And then I'm going to check for lymph nodes. You have some kind of behind the neck. Those are your cervical nodes. I'm going to check under here. Have you do some different things. Check your jaw, make sure there's no clicking or anything. We'll check your vision, your eyes, inside the ear, mouth. I'm going to have you stand up at some point and check your spine, make sure that there's no curvature. You've never had any history of back problems or scoliosis or anything? Okay. I'll probably have you do some different things that can help me assess your cranial nerves. So different sensations. I'm going to put this thing called a tuning fork on your head. You'll feel it vibrate. When you can't feel it vibrate anymore, you just kind of let me know, and then I'm going to put it to the back of your ear. You should be able to hear it a little bit longer than you can feel it.
Oh, okay.
And I'm just going to make my way down. I'll probably have you do some things like press against my hands, and we'll check for some like carpal tunnel issues. Just some simple little things that might seem silly, but it helps us get a good assessment on you. I'll check for some pulses to make sure that they're, you know, down in your feet, around your ankle, make sure that you've got good circulation. You've never had any numbness, tingling? Okay. I'll check for nail trigger, which you have beautiful nails, or not your skin trigger and your nail, your capillary refill. I'll check for the color there. Okay. And it's kind of see-through, so I should be good to do that. Because your toes are painted too.
Yeah.
And then, like I said, the normal reflexes that you've probably had done a bunch of times at your knee and your elbow. And I'll just kind of feel around, and I'll try to explain things as I go, okay? So I'm just going to start by putting my hands in your hair, okay? You don't have any tender spots?
Nope.
You can just keep your eyes closed and relax.
You'll put me to sleep.
Yes. And I'm just kind of looking on the outside of things, and then I'll use the light to take a closer look inside your ears and that. And we just use our hands on both sides so that we can compare, because if I feel something that's not quite right over here and it's not the same there, then that makes us want to investigate a little bit further. Can I have you open your mouth and close your mouth? Good job. No click, so that's good. Okay. Do you feel any sensation other than firm pressure right here?
No.
Okay. Good, and the neck felt fine. No tenderness up here by your collarbone at all. Okay. Good, good, good. Can I have you raise this arm up? No crepitation there, no arthritis. Let's try that one. Good job. Okay. All right. Let's see your hands here. You're not cold. That's a good sign.
No.
Skin is nice and supple. You drink enough water in a day, or
Try to.
yeah.
Get those 8 glasses.
Yeah, it's really hard. All right, cap refill is good. No major skin issues, and I'm gonna check over here too. All right, before I go too much further, I'm gonna grab my pen light and I'm gonna check your eyes. So this light, I'm gonna shine it from the side right into the center of your eye. You can just look right here at me, okay? Good. Awesome. Okay, can I have you look up? I'm just gonna look up in your nares. Everything looks normal there. How about your mouth? Have you had your tonsils out?
Uh-huh.
Okay. Looks good. Mucous membranes are moist. Very good. All right, so I can put that down now. This is that tuning fork I was talking about.
Okay.
Like I said, I'm gonna hit it. I'm gonna put it right here on your head. You just let me know whenever you stop feeling the vibration, and then I'm gonna move it to the back. So I'm gonna move your hair over just a little bit so I can time that.
Okay.
All right, here we go. Yeah.
Okay. Okay.
All right, very good. Put that over here. I'm gonna come back to that when we check for some sensations. Right now, actually, what I wanna do is use this chart. I'm gonna stand about right here,
Mm-hmm.
and I'm gonna have you read. Let's start here. Can you read that line for me?
2, 8, 4, 3.
Good job. Okay. Let's see about this one right here. Just those first 3 numbers will be fine.
6, 3, 8.
Okay. Good. How about the next one?
8, 7, 4, 5.
Good job. Why don't you read to the smallest one that you can read? Just keep reading them.
Okay. 3, 7, 4, 2, 5, 8.
That's pretty good. Good job. Okay. So we'll be done with that for a while. Now, I'm just going to do some stimuli. It's supposed to represent like painful stimuli. It's not going to be painful, but you're going to just tell me. Yeah, I'm going to have you close your eyes, and you can just tell me if it feels like a prick or if it feels like something soft, okay? Or if it feels dull. All right, close your eyes. What was that like?
A prick.
Okay, all right, close your eyes.
Soft.
Okay, all right, good job. And then you just feel, should be something dull?
Yes.
Okay, good job.
No
Same
sharp.
thing with your, you just feel, you feel that all the way up, right?
Mm-hmm.
And you feel that?
Mm-hmm.
Okay, good deal. All right, I am going to, while we got your eyes closed, I've got a couple of things over here that I want to check. Your olfactory nerve is what we use for smelling and that sense. So I'm going to put a couple of things under your nose with your eyes closed, easy things to recognize. And if you can tell me what they are, then we'll move on, okay?
Okay.
All right. So go ahead and close your eyes, and I'll bring over the first one. Okay?
Coffee.
Good job. Okay, a little whiff.
Alcohol.
Yep, good job. Okay. Alrighty. I'm just gonna write these things down. All that was good. Okay. And one of the things I was looking at with that pen light too, the white around your eyes is called the sclera. You didn't have any redness or anything going on, no extra tear production, no drainage. So that was all good. I didn't feel any lumps in your head. You know, as I went down, all the nodes were where they were supposed to be, no bigger, no smaller. And you had no pain, right? One thing I do want you to do is, can you turn that way and swallow? No pain. Okay, and turn that way and swallow. Good job. Okay, I'm gonna grab my tongue depressor. And first I just wanna take a little bit better look in your mouth. And then I have to stimulate your gag reflex, but we'll make it really easy and simple, okay? So first I'm just gonna take a look. Okay, here you go. Okay, good job. Alrighty. So I am gonna take a look in your ears, my otoscope, okay? I already looked in your nose, my pen light's good enough for that, but I want to take a closer look inside your ears. You said you never have any dizziness or anything, you don't have any ear pain right now, and I didn't see any drainage when I did the initial assessment, so I'm just going to take a little bit of a closer look here, maybe. There we go. Okay. I'm just going to pull your ear up and back. Look in there. Awesome. Okay, that looks good. Go to the other side. That looks really good too. Okay, I'm just going to do some hand hygiene here. Rid of this. Okay. Next thing I want to do before I move on too much is I want to get a set of vitals. I put some hand sanitizer on, but I want to listen to your heart and your lungs and your belly, and then we'll do some vitals and stuff. If I start moving you around too much or do any palpitation in your abdomen, I could elicit some sounds that would be false. I want to get some true bowel sounds on you. You've been eating like normal, you said, having normal bowel movements. I'll listen in each quadrant. Our abdomen is divided into 4 different quadrants. I'll listen to each one. If it takes me a while, I really need to listen for about a minute unless I hear them right away. And then if I really can't hear anything, it needs to be about 5 minutes in each quadrant so I can make sure that I don't say, oh, she doesn't have any bowel sounds. Sometimes it just takes a while.
Okay.
Alrighty. And you're still comfortable? Okay. All right. So first I'll start up here. Listen to your heart. Good job. Okay, good job. All right, I'm going to have you take a big deep breath in. And you can just let it out. Just a few deep breaths. Good job.
Sorry.
Allergies, that's okay. Do you need a drink of water or anything?
Maybe.
Okay. You're gonna have to hold on just a second.
Okay.
Okay, big deep breath. Good job. Try and breathe in your nose. Nice job. Okay, good deal. Now I'm going to take a listen to your tummy. I'm going to stand over here. Let me move this out of the way. You want me to pause for a minute?
Yeah, why don't
Okay,
we do that? My
sure.
nose is running in my...
That's about normal there.
Good.
And as a baseline, do you run about normal or? Okay, alrighty. Just record what I got here. Well, that thing must not have shut it off. Okay. So you got that. I've done things just slightly out of order, but while I'm still up here at your face, I'm going to have you just look at my finger.
Mm-hmm.
And as I bring it into you, I want you just to keep following my finger, okay? You ready?
Mm-hmm.
Good job. Okay, can you come over this way? Try not to move your head, just move your eyes. Good job. Up and down. And can you put your head down? Okay, no pain.
Mm-hmm.
All right, and lay your head back. Okay, looks good. All right. Okay, well, let's move on to, I think I'll go ahead and listen to your belly. And then, there. We'll move on from there. Okay, I'll listen down here first. Okay. Okay, good. No history of any hernias or anything. Okay, good deal. I'm gonna go ahead and just step to the side here because I'm gonna push on you just a little bit. If you feel any pain or anything like that, just let me know.
Okay.
Okay, then I'm gonna lift this arm up and I'm gonna feel under here. Okay, good. I am going to, this is your radial pulse, okay? And I'm gonna touch here and get a reading on that. And I'm also gonna compare it with this one up here. Okay. I'm just gonna time your pulse here. Okay, we've got about 72 a minute. Alrighty. And you got your temp there. Okay, and now I'm just gonna watch your respirations for a minute here. They're nice and even, not labored, you're not feeling anxious or anything.
Mm-mm.
Okay, good. 16. Alrighty. Okay, so far so good. Any questions for me yet? Okay, I'm gonna get your blood pressure. Then I've pretty much got all your vital signs, and then I'm gonna move on down to those reflexes I talked about. Take a look at your feet, feel for those pulses, okay? Let me grab my
Okay.
blood pressure cuff here. Sometimes this information can sound kind of repetitive, but we just want a really, really good baseline, especially since this is your first time in our office.
Yep.
Okay, I'm gonna straighten that out. All right, you just Just rest that there. Be situated. Okay, I'll hang on there. Okay. 132/90. I'm going to take it in the other arm just to compare. Try and put this guy up here. Get a little bit easier. Okay. 130/80 is what it's saying there. That was in your right arm, in your left I got 132/90. Okay, let me put this up here. Alrighty. Just do a little more hand sanitizer here. This is not meant to be painful at all. It shouldn't be painful. I'm just going to check a couple of reflexes on you. It can give us some information on how quick, responses are with you, reflexes. There are a couple other ones I could check, but I'm just going to tap on your knee and we'll see how that goes. Okay, so just nice and relaxed for me. Alrighty. Okay. Little bit of one. Okay, good job. That wasn't painful at all for you, was it? Okay. I'm going to go ahead and take my stethoscope off. Now I'm just going to check you out here. No pain there. Okay. All right. Let's see here. So this is what I was talking about, that pulse on the back of your ankle. And we mostly just want to know that it's present. That helps us a lot with determining your circulation. Then I'm going to go right up here on top of here, do your pedal pulse. Okay, good. In the back of the knee there. Okay, awesome. Everything looks good. You don't have any what we would call pitting edema. So there's pitting and non-pitting. Sometimes when your legs are hanging for a while, sometimes if you've had a bunch of salty food, sometimes if you're having a true medical issue, like some vascular insufficiencies, you can have some swelling go on down in your lower extremities. And you don't have any of that going on. I can't leave my imprint there at all. Okay, so I'm gonna have you stand up. I'm gonna move this chair away from you. Move it out of the way. I'll have you stand right here and turn your back to me. Okay. All right, can you bend over like you're trying to touch your toes? Very good, okay. That all looks good. All right, you can go ahead and stand up, okay? And then I'm gonna switch places with you again. Now, can you go like this with your hands? Put them together. You don't have any pain, burning, anything like that,
No.
Okay? All right, go ahead and roll your wrists out. Good job. Okay, can you go like this? Pat your legs fast. Do one hand and then the other. Good job, good job. Okay. silly as it might be, helps us check for some of your sensory and motor things you got going on. Let's see what else I want you to do. Can you close your eyes and put your arms out? Okay. You don't feel off balance or anything?
Mm-mm.
Okay. All right, open your eyes, put your arms down. Can you lift one foot up? Good. How about the other one? Okay, nice job. For your gait, I'm gonna have you turn around, okay, with your back to me, and just take a couple steps away, just 2 or 3 steps away from me. Good. Now turn around and come back. Good job. Okay, I'm gonna back you up. Okay, now I'm gonna put my hands here. Can you put your hands on top of mine and press against them? And you don't get unstable at all? Okay, good job. Can you shrug your shoulders up against some pressure? That doesn't hurt at all?
No.
Okay, good deal. Well, let me move your seat back over here for you. All right, and I'll go over just a few things. All of your vital signs look fine.
Okay.
You don't have any history of any issues. The only problem that you're really having that we saw was the seasonal allergies.
Yeah.
Probably have a little bit of post-nasal drip. Your throat did not look red. Your ears didn't look too bad. But I'll just tell Doc all those things so that he can get you some appropriate change in medications. Maybe you actually need to use a little bit of a nasal mist or something like that.
Okay.
So I'll let him know all of this. Do you have any questions or concerns at all?
I don't think
Anything
so.
I can help you with? Okay, well, let me shake your hand. Thank you so
Thank
much.
you.
Have a good day.
You too, thanks.